Hi, this is Sarah Walsh, and I want to welcome you to this pre-recorded webinar with Harmony Health Wellness webinars called Demystifying Therapy, Starting Your Healing Journey. Got tongue-tied there. So my name's Sarah Walsh, and if you signed up, you might have noticed some letters after my name, MSW and LSWAIC. I'd like to go in and explain that in just a moment because I think that will enhance some of your understanding of the mental health system. You'll come across a lot of professionals that have letters after their name, some of them don't, and I want to give a second to explain why that might matter at all. So before I go into that, I want to take a moment and show you the website for Harmony Health Collective, who's putting on this webinar. You'll notice throughout this webinar that I'll just show you the web page for where I'm getting some resources from a lot of times because I want you to find this later really easily, know what the screen looks like, know what you're looking for, that sort of thing. So one moment here. And do pardon me, I'm dealing with some sinus issues here if my sinuses start sounding clogged. So here's Harmony Health Collective. Who Harmony Health Collective is really is a group of practitioners that provide integrative medicine, health education, which is part of this arm that this webinar is covering. There's multiple wellness courses as well that you can look into if you'd like as well to find support, ways that you can build on your healing journey. And also Harmony Health provides comprehensive wellness support as well. I invite you to take a look at their website after this webinar and check out the collective. See who everybody is, what that's all about. So let's go back to introducing myself. So the first three letters after my name, MSW, some of you may be familiar with that, others of you not so much. I'll explain it anyway. So MSW stands for Masters in Social Work. So I went to school to learn how to be a social worker. Social workers can wear many hats. We can do research, especially if we go and get a PhD. We can do case management. We can do therapy. So I am a therapist. And that LSWAIC stands for a licensed social worker clinical license. It's an associate license, so I'm working my way up through getting supervision hours to get to that full licensure status in the state of Washington for right now, maybe branching out as I go along in my career as a therapist. So what all are we going to be covering today? And if you signed up, you saw some things about finding a therapist, trust, mental health, getting some support. We'll try to hit on all of these subjects and keep it to an hour. Hopefully you can listen to this on your lunch break, that sort of a thing, whatever's convenient for you. But I hope you get a lot out of this, and please reach out to Harmony Health if you have any ideas for future webinars, subjects you'd be interested in learning more about. This one will be very focused on mental health and therapy in general. So this first thing that I want to go through is really mental health or even mental illness. I guess I should say I want to create a definition for you here. So if we go to a website here, this is NAMI's website. They're the National Alliance on Mental Illness. They give us a handy dandy definition here for what mental illness is considered. So mental illness is a condition that affects a person's thinking, feeling, behavior, or mood. These conditions deeply impact day-to-day living, and they also affect the ability to relate to others. So this website in general gives a lot of resources and support on different kinds of mental health diagnoses. I want you to see what mental illness looks like and why why there's an importance on diagnosis. We'll kind of start there before we talk about finding a therapist and that relationship. Give you some red flags for why should I be interested in therapy? Why does mental health matter? Those sorts of things. So mental illness, this isn't like a terrible death sentence sort of a thing. I have a mental illness. Really, if you look at that, having a mental illness is telling you something about your level of functionality, that there is something affecting how your brain processes things, how your feelings work, the kind of behaviors you might engage in. So I want to kind of normalize too. If you look through and dig into resources, you can see how common it is to have a diagnosis, a mental health diagnosis. Where is that coming from even? We have a manual actually called the DSM-5 TR. The TR just stands for text revisions. It's the most recent manual that has a whole list of criteria for different mental illnesses. Why does it matter to get a mental health diagnosis? You know, like I said, there might be some fear. Again, pardon for sinuses, and if I need to take a drink of water real quick here. So part of the thing about getting a diagnosis is it tells your provider what the most effective treatment might be. A lot of researchers put effort into figuring out what type of treatment might work well with a particular diagnosis. So let's say they don't have any mental health diagnosis. Well, then a therapist really could just start tossing things at the wall at you, just hoping that something sticks, hoping that some kind of treatment works for you. And that's the last thing that you want to have happen to you, really. You're not some big guinea pig. Um, we've done a lot of research to try to narrow down what therapy is most likely to work for you. So it's not a bad thing to get a mental health diagnosis. Matter of fact, most intake processes try to nail down a diagnosis to figure out how to more effectively help you. So view it as I have a mental illness. Knowing what I have helps me figure out what the treatment should be. Similar to physical illness, if you don't know what's going on with you, doctors don't know how to treat it, right? If I hadn't gone into a doctor, I might not have recognized what's going on with my sinuses, those sorts of things. We need to have some of those labels. It's not necessarily a terrible thing. So thinking about having a mental health diagnosis, if you've gotten one, odds are you were trying to find a therapist. When should you try to find a therapist? I don't know if you've ever thought, hey, am I overthinking this whole thing? Maybe I don't need therapy at all. There's a wait list. It's good to know, when should I go find a therapist? When is it worth being on somebody's wait list? So let me give you a few criteria. There are a lot of different reasons to go into therapy and reasons why you might leave therapy for a while and come back. A lot of folks that I talk to seem to have this perspective that a good time to seek therapy is, if you see things that aren't there, you hear voices, maybe there's just a lot of dysfunction in your life. If there's a lot of dysfunction going on, or you feel like, oh, I don't know how to process my emotions, even talking about psychosis, those hallucinations, whether it's audio, visual, those are all great reasons to seek therapy. You could also want to see a therapist because you just need an impartial sounding board. I mean, we're humans, we're not robots. I can't say we're 100% impartial 100% of the time, but we're not living life with you like like your family members or your spouse or your kids or your roommate, like all those folks are. So we're a little less, we're not so close to the issue, I guess you could say. It's okay to need just a sounding board. It's kind of what I'm trying to say, to normalize this idea that perhaps I just want a therapist as somebody to talk to because I don't feel comfortable burdening somebody else. Again, going back to this idea of more severe red flags, things to add in there if you've had a traumatic life event. Maybe there's a big life transition. Maybe you suffered some form of physical or emotional abuse. Great reasons to see a therapist. If, along with trauma, another great reason to seek therapy is if you're trying to figure out what wellness looks like as well. I guess let me explain where I'm going to with that. I told you what a mental illness is, and sometimes you get really used to this idea or people telling you what you don't have going on, but a therapist can help you figure out what wellness looks like too. Maybe you've already been to a therapist before, processed a lot of trauma. Great for you. Congratulations on putting that work in on yourself. But maybe you notice then that after you quit, you didn't really know what to do next. What does wellness look like? Somebody told me that I completed treatment and I should be able to handle any blowback from trauma that I experienced. I went through an effective treatment, yada yada. What does wellness look like now? What's next for me? A therapist can help you figure that out too. You know, a lot of times the folks that I talk to, they just don't know what that next step is. Is it finding a hobby because now I don't have to worry about housing? Is it spending quality time and understanding what my goals might be about quality time? Because before I didn't know how to have close relationships, close trusting relationships. So there can be a lot of reasons, just recapping it. It could be something's wrong, there's a deficit, or it could be I want to build a strength. I don't know how to build up a strength, and I want a trained professional to tell me how to do that. Let's go into the therapy side of things. Uh, I work my typical 40 hours is spent at a community mental health agency. So community mental health, they work with clients that have state insurance. It's usually not a private pay sort of a deal. I'm going to try to do a quick overview on the difference between community mental health and maybe the private therapy world here. Community mental health, here's some things to know what to expect. To be honest, just being honest, a lot of community mental health providers do not stick around long term. You might not have the same therapist for your entire treatment. A therapist might tell you, hey, I've moved on, I've got a different job now. And I think it's important for you to expect that and recognize that as difficult as making transitions from one therapist to another might be, your healing journey is personal to you. That healing doesn't stop because your clinician left. If you're in a boat where you can't afford private insurance and you're seeing someone with community mental health, that doesn't mean that you're getting substandard care. What it does mean by not having private insurance is there are certain limitations on how much choice you have. So I guess I'm trying to set you up to have an understanding of what you're walking into and maybe not be so shocked if you have some struggles with the community mental health process later. I love what I do. I love my coworkers. Community mental health is a great asset to the community for people who have state insurance and couldn't afford therapy any other way. Private practice therapy. So how do you find therapists in private practice? Looking at Psychology Today profiles online, is a huge resource. We also have other websites springing up now. Therapy Den is one of them. You can look up different therapists and their specialties, what insurances they cover. In private practice, or looking through those profiles, I should say, because a therapist could be part of a group practice as well, an office space that has several therapists in one building. When you're looking through those profiles, you get to pick and choose. Community mental health, unfortunately, you don't necessarily get that pick and choose process at every agency. A lot of agencies don't. It's just who's available at the time. If you have private insurance, you get to pick and choose and get some familiarity. Some therapists might not be paneled with insurance. They might have what's called a sliding scale. And if you ask about that, that's a pay scale that's based on your incomes rather than having a flat fee, which can be a couple $100 per session. They'll scale it to what your income is to try to make it more affordable to you if they don't take insurance. Real quick here as well, I just want to harp on another way that you can get that paid through insurance. Let's say that your therapist is in a private practice or a group practice and they don't take insurance. You could still ask for what's called a super bill, and they should be able to coach you through that process to submit a super bill to insurance for reimbursement. So enough about general overview, I guess, on when to seek therapy and some different processes there. I'd like to talk you through, I guess, the importance of the therapeutic relationship. I gave you several reasons that you might seek a therapist, and there are many modalities underneath that. But one thing that we find here, I'm going to take you to a quick little study here. Okay, so this is from the American Psychological Association's website. The article's called Better Relationships with Patients Lead to Better Outcomes. So, as much as I want you to understand that therapy might look different if you're pursuing therapy to address a trauma versus build up a strength and have a verbal sounding board there, the relationship is super important. It's not all about the training. So here I'm going to zoom down here and show you a little bit about what they found in 2018, I believe it was. So there was a lot of research that came about from an APA task force. So this task force was called the APA Task Force on Evidence-Based Relationships and Responsiveness. So what they found was that a good therapeutic relationship, here I'll stop sharing and go back to just chatting with you. So they found that a strong therapeutic relationship made it more likely that therapy was going to be effective for you, the client. And why was that? There were a couple things they noticed in strong therapeutic relationships. So a couple things that they noticed in their research as a task force was that a good bond between client and therapist included the ability to agree on therapy goals. So one red flag, if you are searching out a therapist, is if that therapist tries to say, I guess, lead what the goal is, and you find yourself sitting in the chair thinking, well, how did this happen? How did we get here? I thought therapy, I don't think that was what I wanted to work on. You know, it might have you, a red flag would be if you feel that you weren't listened to. So if you are being listened to, you can agree on your therapy goal. Your therapy goal should be something that that has some standards on it that you're looking for. Your therapist shouldn't be willy-nilly like, oh, we'll work on this like forever. I don't know. Uh, there should be some time boundaries there. Like, oh, in the next 3 months, we're going to build this skill of how to control my emotions better, for instance, or maybe how to understand my emotions. It's time limited there. And the more specific, the better. Know how to control my emotions. Well, that's really broad. Is there a specific emotion? Um, is is there something that's going to clue us in that we've reached the mark on our goal? Like what's currently going on with you and where are we trying to go? All those things should be included and you should be able to agree on that. What else did we figure out? We also figured out that client feedback is really important. You should be really concerned if your therapist never asks you, hey, how's it going? I ask my clients at least every couple weeks. I feel like I'm slacking a little bit if I just once a month, but I check in every couple weeks and I say, how did that piece of homework feel to you? Is there something we need to change? Or did you feel heard last week? Some therapists might do little surveys or have a template for things. I usually just do verbal conversations. I can get kind of informal about things. But you should be able and be comfortable giving feedback and receiving feedback from your therapist too. They might notice some roadblocks going on. Like, what if you haven't been coming to therapy or you've missed the last couple weeks? You just keep canceling. Why is that? Myself, having a master in social work and social workers being able to do case management type things, sometimes one of the things that I'll pick up on is it's not necessarily that you don't want to show up to therapy. Maybe there's a roadblock that I don't know about and it's okay to tell me about. Like, what if it's transportation? You didn't mean to miss the last couple weeks, but you don't have enough gas. Maybe I can do a Zoom session with you. You know, you should be able to bring up those sorts of things, and sometimes those check-ins with your therapist help you feel empowered to bring those things up. Another thing that I would say with that therapeutic relationship and being able to give feedback is it's okay to go with your gut a little bit here. You should be able to have some facts where you say, I had this concern. I was able to bring it to my therapist and we worked together. Facts are good. But also, you should have some sort of feeling in your body that, hey, I can loosen up with this therapist. I don't feel all tense. And maybe the first couple sessions, you might feel tempted to kind of scrunch up in a ball a little bit, because starting therapy can be uncomfortable, especially if you were raised with a group of folks that maybe made it seem like therapy isn't the thing to do, or I should be where I'm less than because I'm in therapy. Maybe the first couple weeks feel off, but eventually there should be this adjustment period where you're like, oh, okay, I'm comfy in here. Your gut should tell you this is a safe place to be with my therapist. Here's the last thing that I want to talk about that this APA task force found in 2018. They also found it really important that you, the client, have a therapist that's willing to repair ruptures. What do I mean by ruptures? I talked about attendance issues on the part of someone coming into the office, but what about me as a therapist? What if I'm the one that you're like, hey, the last couple of weeks you canceled my session and honestly it makes me feel like I'm not important. Or maybe the rupture is something triggered your therapist and they should be willing to talk about that. It's not your responsibility to have to worry about, is my therapist taking care of themselves? You shouldn't have to be worried, am I triggering them? But sometimes, because we're human, that happens. And if you feel like we're responding differently to you, maybe we're being triggered, And we as therapists should be comfortable building a framework to repair something that did some damage to the relationship. And certainly a therapist being triggered by the person in their office, that's an important conversation to have. That's what I'm trying to get at here. So don't be afraid to let your therapist know, hey, there's something going on that's not working for me. Maybe you don't have a good fit with a therapist if that's what's happening there, is you're sitting there thinking to yourself, oh gosh, I just don't know how to tell them that I feel like I can't talk to them. Uh, Maybe there was, I'll go into one more situation here that's happened before. When you start therapy, there should be some understanding of what stays private and what doesn't. One of the things that doesn't stay private is things like CPS calls. It seems like a child's in danger. I've had experiences with clients before that after I've let them know, hey, there are times where as a mandated reporter, I've got to call CPS. I do have to call CPS because of some information they shared about, potential danger to a child. They figure, oh, the only person I told was my therapist. Sometimes I will just upfront say, hey, I did have to make a call to CPS. But that can cause a rupture. That can hurt the trust. Even if I warned you up front that this would happen, folks that I meet in my office, on the occasion that this comes up, it can be hurtful. It's logical that it's hurtful. My encouragement is that you try to work it out with your therapist and figure out, is this able to be salvaged or repaired? Part of the therapeutic relationship as well is being able to build trust. So things like that, you can't repair something that's gone astray, gone wrong, if there's not trust. And let's just say, I don't know where anybody watching this webinar is at, but let's just say for a moment that trust is not in your wheelhouse. Then what I want to encourage you to do is look for a few things, some characteristics that lead to being able to build trust. Remember earlier where I was like, you should feel safe in the office of your therapist. If you feel safe, you can be vulnerable. Vulnerability builds trust. Part of that therapeutic relationship too, not every therapist practices self-disclosure. So that would be something like, for instance, I have a cat. I've now self-disclosed to you, I have a cat. And that can help build that bond. Vulnerability, being able to be vulnerable is important for you as a client entering into therapy, to be able to be vulnerable. But I think it helps too to know sometimes in the right context that your therapist is human too. Now, here's some things that shouldn't happen with vulnerability. Your therapist shouldn't be telling you about, oh man, I went on this blind date last night and oh, it was just a doozy. It went terribly. What are you doing this weekend? Like, that's too far. That's too far. That's not a therapeutic relationship anymore. That's getting into a personal realm that you want to have some separation. What other things build trust? There's vulnerability, and there's also time. Just the time that you're spending with your therapist also helps. Trust can come in time. Shared values also help with that bond. If you notice that you're both coming from the same place, some folks seek out therapists that they know they can relate to better. Like, I've gotten requests before that someone wants a therapist that understands some issues that people in the LGBTQ plus community might have, or therapists that have experience working with men, or have experience with relationship dynamics or marriage, or any number of things. that can help with trust. I know you have experience. I know you're not going to just make something up because you've got experience. So, moving on, we talked about a couple different things. We've talked about mental health, what diagnosis is, when to seek therapy, some different types of therapy. Uh, as far as reasons you might pursue therapy, you can Google that. That could be a whole different webinar. The specific types of therapy that there are. I'll let you in on my type of therapy, what I specialize in a little bit here. I want to give you some resources real quick. So, uh, what I'm going to start out with, actually, one second, is a crisis resource. Seeing if I can get you to that real quick. Hopefully. Here we go. Okay. So sometimes when you're looking for a therapist, there might be a wait list. And let's say that you're really struggling right now. There are resources out there for when you're struggling. So this is the web page. This is SAMHSA's web page, actually, but they're advertising the 988 suicide and crisis line. So we have something, you can look through these resources later, but one of the things that I want you to know is we've got a much easier system. Before, we had these super long numbers for regional crisis lines or hotline, and they were great. But what if you don't remember that number? Now, just like for medical emergency, you can call 911. You can use the 988 line if you are in a crisis, a mental health crisis specifically, that you feel like you can't dig yourself out of. I want to assure you, too, that if you dial 988 and try to talk through a crisis, these are folks that are trained to support you and empower you to stay safe and know how to explore resources beyond this short-term call that you're engaging in. Nobody's sending anybody to your house unless they're worried about your safety. If you do find yourself in crisis at at some point and you're able to come up with a plan with the person on the phone, hey, I'm really struggling right now. I just seem to be taking a dip in my mood, and I feel like I can't eat anymore. Maybe you've got a history struggling with depression, just throwing a situation out there. If you can come up with a plan like, hey, I'm not saying that I feel so depressed that I don't want to live anymore, I want to kill myself. I just feel sad. These are some things that make me feel happy. That right there is a perfect example of nobody has to come out to your house or invade your privacy. It's an anonymous call for support that you were able to make. So just knowing that and trying to support you in getting that resource, a crisis resource, it's not a bad thing, and it's for a mental health crisis. They support people struggling with suicide, but it doesn't have to be limited to that. So I want to give you that resource, because if you ever find yourself on a wait list and you can't get into a therapist right away, but you don't know how to handle things when they're rough, 988, it's 24 hours. They've got a text line now too, as well, that you can get connected to, but dialing 988 gets you very quickly to someone who can help you out when you're not sure how to help yourself out mentally, and that's okay. So, what are some other skills that you can use when you're on a wait list, or maybe when you're just first starting out in therapy and you're like, ah, gosh, I don't know what to do. Here's where I'm going to talk to you real quick about the type of therapy that I do. So I am trained in DBT. What does that mean? DBT stands for dialectical behavioral therapy. It's a skill based therapy. It works for people that struggle with anxiety, eating disorders. It was primarily made initially developed for those that struggle with suicidal ideation, but it helps a range of diagnoses. It's a skill based therapy. That's what I want you to know. It teaches you skills, essentially. So, my hope is to give you a couple of skills that can help you out as we're drawing to a close on this webinar here. So, uh, first skill that I want to talk to you about is not necessarily one when you're in crisis. It's more so a skill that you might use to just maintain control of your emotions. You know, you're not an absolute mess. You're not distraught. You're not in this place where I don't feel like I can go on anymore. You're just maybe having some ebbs and flows, and you want to navigate the ebbs and flows of life well, effectively, one might even say, figuring out what works. So I'm going to share my screen. And this is actually, so the creator of DBT, if you want to Google her, is Marsha Linehan. She's got an autobiography as well that she created uh, that you can look into as well. Life Worth Living, I think it's the title on that. But what I'm about to show you is from her DBT skills manual, and it's just a little handout related to that. So again, let's say that you're just starting out in therapy, or you're trying to figure out how to cope while you're waiting to find a therapist. This is a skill that's a good place to start. So let me share my screen here. Here we go. Any second. Okay. So this skill here, it's called accumulate positive emotions, but it's in the short term. So there are things that can build positive emotions in the short term and then in the long term. I'll try to walk you through both here. So in the short term, you're looking to build positive experiences in the now. One thing that can be helpful is to create a positive here. I'm going to actually take this tab out entirely. There we go. Hold on one second. I'm going to switch tabs just to make sharing a little bit easier. Appreciate your patience. Sometimes sharing in technology, it just doesn't work the way that you wanted it to. Go figure. Okay, so one of the things that you can do to build positive experiences in the short term is to have a pleasant event list, if you will. What are things that I just enjoy, that I have on my to-do list that I would just like to go do? Is it going to a yoga class? Is it going on a hike? Is it staying in and getting a nap? Because maybe I don't get naps anymore. It's just my children. You know, it could be a lot of different things, but keeping a list, that way when you're like, oh, what do I want to do? I can just go to my list and I can check something off. Easy as that. One of the things that we encourage in DBT is that you have at least one pleasant thing a day that you're planning on. Sometimes you might feel like avoiding doing that pleasant thing. And here in this handout, I'll reference something called opposite action that in DBT, trying to quickly explain that, that's just if I have if I have the urge to avoid something, opposite action tells me to do the opposite of avoid. What would the opposite look like? To engage. I'm going to engage in something that I would enjoy. So the other thing about doing a positive experience You should be mindful. For those of you not familiar with the term, it's really being present in that moment. If I'm going to do something pleasant for myself, like let's say that it's a hot day and I want to get an ice cream. I am going to eat that ice cream and take in every flavor. I'm not going to be scrolling on my phone, checking my Facebook, are there any notifications, seeing what's new on TikTok. I'm going to be focused on eating that ice cream. What if I go out with friends? I'm going to be focusing on conversations with friends while sharing that ice cream. So the positive experience is more effective when I'm actually engaged rather than kind of half-heartedly, well, this hike is nice, but I can't wait till I do the next thing. Like I got to do grocery shopping, what have you. You know, the the other things tied to mindfulness here is trying to refocus your attention. It's okay if you get distracted for a minute. Just go back to what you're doing. You know, also be unmindful of certain things. Be unmindful of what? Be unmindful of worries. Worries happen. You don't want to focus on, oh gosh, this is the only positive thing that I have going on today. I don't know what I'm going to do with myself. Oh, today just sucks. That's going to take away from that positive experience if you're allowing yourself to be distracted. If you are distracted momentarily, go back in and figure out, oh, what's something I'm missing here? What are the sounds around me as I'm eating this ice cream? Is there some good music going on? What can I do there to stay engaged? So let me go through and talk about, here's a pleasant event list from the handbook, actually, just if that helps you, some different options that you might have. I'm going to try to scroll down a little bit. In the handbook, there's lots of useful things. I know I'm going kind of fast, but you can actually buy this workbook for yourself if you need a list for pleasant events. I want to talk about long-term as well, finding positive emotions, and then we'll move on. So here's the difference about long-term that I'll walk you through. Don't avoid the idea of accumulating a positive emotion just because it might take a while if you're planning long term. In the long term, it's important to identify some values that you have. Like, let's say that I have a value related to family. I really value family connection. That value is going to help me come up with a goal. Maybe my goal with family is to have 3 home cooked dinners a week. Let's just say that for kicks and giggles, okay? If that is my one goal, I'm going to have some action steps for it. So I'll go ahead and I'll stop presenting here. But long term, that might take a while. Like, what if it's a trip that you want to go on? That takes a lot of planning. But if it's important to you, create those little action steps to bring that to fruition. So why do I talk about creating positive events? Why would that matter at all if you're sitting on a wait list or things, or you feel like it's okay to wait, like you're just not happy with where you're at in life? Being intentional about creating positive emotions or wanted emotional experiences through something you enjoy, whether it's in the short term or the long term, mixes your day up. What if the first part of your day is something that you had no choice in whether you wanted to do it or not? Maybe it's your job. Maybe you love your job. Maybe you hate your job. I don't know. Let's just say that your job is one of those things that, man, like it's okay. But if I didn't have to work, I wouldn't. Doesn't necessarily give me joy. I'm going to take a water break real quick. Being intentional about creating a moment for positive experience mixes up that feeling that you might have had waking up to a job that you were iffy about. And then, oh, I've got something to look forward to. At the end of work, I'm going to hang out with some friends. At the end of work, I'm going to check out this new playlist on Spotify I've been dying to listen to. Or maybe in the long term, in 3 months, I'm going on vacation to somewhere I've never been. It can mix up your emotions so you're not only focused on what's going wrong. So that's one thing that you can do for yourself. Another easy pick me up thing, build a playlist for yourself. Have you ever thought about, I don't know, maybe it's just me. Sometimes I watch sports events. I'm not a super sporty person, but if you're looking at, like, let's say we're looking at uh, a sporting event, most of them usually have music. If it's a baseball event, every now and then you have that music break. Maybe the mascot comes out and it's like, yeah, and gets the crowd going wild, right? Your playlist can be your hype music to get you going like, oh yeah, I'm ready for this. I might not like this or want what's going on, but I'm ready for this. So getting a playlist together, uh, creating some intentional positive experiences, that's something very good for yourself. I will share with you one last thing. Here, let me see if I can pop up the handout for you really, really quick. This, if I can find it, this is a skill. Here we go. This is a skill when you are in what I would say distress. So more in that place where I don't know if I can stand another minute in this room, or I've been through trauma and I'm feeling triggered, or I was supposed to get help from my therapist, but I missed a session this week. This can be a really helpful skill. So go to the window for this. So in DBT, we call this, pardon me in my sinuses, y'all. We call this a stop skill. There's a lot of acronyms in therapy overall, but especially DBT. So the stop skill, that S is just how it sounds. You stop what you're doing. You try to remove yourself from the situation that's causing you a lot of intense emotions. Even if it's just buying yourself some time with a bathroom break, that's okay. Go for it. The next thing that you need to do is, now that you've stopped, take a step back from that situation and just observe what's going on. What is going on? Is something triggering to me because it seems like a traumatic event that I had? It seems familiar, but if I look at the facts of the situation, that's not actually what's going on. It just feels familiar and traumatic. Maybe my plan, or what I'll do to proceed mindfully, as it says in this worksheet, is going to be to shorten my stay in this place, or try to be honest if it's with friends. Hey, I'm just having a tough moment right now. This kind of reminds me of something difficult for me. That might be something you do. Maybe you observe that you are getting very upset and you noticed, hey, it's been 5 hours since I ate anything. Sometimes neglecting our basic needs like eating, sleeping, getting some movement in, that can really mix things up in a bad way for us. So the stop skill just teaches us a way to stop a situation that's really bugging us in some way from getting worse. It's just like a little band-aid, just a little band-aid. So hopefully that helps to give you a couple skills here to walk away with. Whether you're in crisis, whether you're just trying to bring some wellness to your life. I hope that this webinar has been really informative. I've tried to give kind of a broad understanding of what to look for in a therapist, but also ways to empower yourself so you know where to look for things. If you're interested in DBT, you can find lots of things on the internet, lots of great podcasts about dialectical behavioral therapy, but there's so many other therapies out there as well. Feel free to explore a little bit. Use some Google keywords here and there, like best therapies for trauma. Lots of different things will come up. That might help you find a therapist. I want a therapist that can do this particular therapy that I read about. Uh, just to summarize, I think when you're trying to find a therapist, communication is really important, and being able to tap into that therapeutic relationship. Another thing is feeling heard and feeling like you understand why a type of therapy is being recommended for you. Like I was able to tell you, DBT is a skill-based therapy. So if you benefit from things you can actively do, actions you can take, this is a great therapy for a lot of people for a lot of reasons. I gave you some diagnoses this typically works for. Your therapist should be able to do that too. So my hope today is that if you do have any questions following up, you'll reach out to Harmony Health Collective. They can certainly send some emails my way, but feel free to tell us what other webinars you would be interested in. What kind of topics do you want to learn about for wellness? Are there other things about mental health that you'd like to understand better? Would love to get some helpful resources out there to you and get some more webinars going. So I hope that you've enjoyed our time, and until next time, I'm Sarah Walsh with Harmony Health Collective, and I hope to see you next time.